Hi, everyone, and welcome to this podcast. I'm Dr. Michael Wald, also known as the Blood Detective. Today, we're going to be discussing the importance of nutritional supplements and how specific lab tests might help you determine if you have specific nutritional deficiencies. Let me start off, first of all, by giving you a quick introduction to me for those of you who are new to this podcast, which is called Ask the Blood Detective. My main intention is to educate listeners into how you can become your own personal blood detective. What that means is you'll gain sufficient knowledge to help you make your way through the morass of medical health care. Because, and I know it sounds cliche, but it's true, an educated consumer is the best consumer. So throughout this presentation today, called Vitamin Vitality, and throughout all of the podcasts that I presented on this Ask the Blood Detective podcast shows, the same theme is throughout. Namely, that you'll learn about the topic in general. You'll learn information about how you might be able to figure out if this is really an issue, a health issue that you have or a loved one. Although, disclaimer alert, we always want to rely on the professionalism of physicians or licensed doctors to make appropriate diagnoses. But that doesn't mean that you shouldn't have input, because input matters. All of the Blood Detective shows also will teach you some aspects of laboratory related to whatever the topic is. So today, on this topic of vitamin vitality, I will be speaking about laboratory work relative to nutritional testing. If you'd like to reach me with comments or concerns, my phone number is 914-552-1442. 914-552-1442, and my email is info@blooddetective.com. And the website, which is loaded with all sorts of free content, is www.drmichaelwald.com. That's drmichaelwald.com. Okay, let's get into this topic of vitamin vitality. First of all, you need to understand that nutritional supplements are essential for maintaining optimal health because they provide the body with essential nutrients, minerals, and other nutritional components that may be lacking in your diet. It's crucial to understand which nutritional elements your body needs and what you are specifically deficient in, and that's where testing comes into play. But testing isn't the only way we figure out if we need nutritional supplements. For example, if someone is depressed and they have dry skin and their hair is falling out, this might be a protein deficiency and or a fatty acid deficiency, an essential fatty acid deficiency. So by analyzing various laboratory tests, specialized laboratory tests known as biomarkers, we can also measure how nutrient levels, or not just the level of nutrient, but how well the body is using those nutrients. So thank you so much for joining me today as we delve into the world of nutritional supplements and the vital role of laboratory testing for optimizing your health. So a few basic concepts, and I'm going to mention these concepts throughout the entire talk because you can't hear them enough. And, if you are serious about your health, you don't want to simply listen to this podcast once or any of my podcasts on Ask the Blood Detective. You want to listen to them more than once because they're seriously detailed. But I've found out over my 31 years of clinical nutritional experience to not hold back details with people. People will filter what they need to get, and if I limit the information, that's going to limit what they can get. Okay, so vitamin supplements can be helpful. They can be a helpful addition to your diet, but they're not to take the place of your diet. Vitamins are essential nutrients that our body needs to function properly. That's why they're called vitamins, vital. They play a vital role, therefore, in maintaining our overall health and well-being, and a deficiency in any one of them can lead to a variety of health problems. So there are about 13 vitamins that our bodies absolutely need, and they're divided into two categories, these 13 vitamins, the fat-soluble ones and the water-soluble ones. Fat-soluble vitamins include nutrients like vitamins A, D, E, and K, but also omega-3 fatty acids and melatonin are also fat-soluble, but the classic ones that you read in books are A, D, E, and K. And these fat-soluble vitamins are stored in the body's fatty tissue. That's why they're called fat-soluble, and they can accumulate to toxic levels if they're taken in excess. Water-soluble vitamins, on the other hand, include the B vitamins and vitamin C. They're not stored in the body. That's important for you to know. Water-soluble vitamins are not stored in the body, and excess amounts, therefore, are excreted in the urine, helping to prevent toxic effects. Now, that's not to say that water-soluble vitamins are always safe, because they're not. For example, taking too much B6 could cause an irreversible neurological condition of neuropathy. Vitamin supplements can be helpful for people who are deficient in a particular vitamin, or those who have a medical condition that makes it difficult for their bodies to absorb certain vitamins. Plus, you need to realize that chronic health problems usually have the body or increase the body's need for nutrients, so that a person under these various stressors of disease, let's say cancer, you name it, they might have a huge amount or a huge need for supplements just to break out even, so that the recommended daily allowances, also known as the recommended daily values, are far too low for anyone who has any increased need for nutrition. And I mentioned a moment ago that there are conditions in the body where the body doesn't absorb certain vitamins. For example, people with celiac disease, which is gluten intolerance, they generally do have a hard time absorbing B12, and they may need to take a nutritional supplement. They're usually protein deficient. They need extra proteins. They're usually chronically anemic, so they're going to need to take iron. And regular gastroenterologists, although they're quite adept at diagnosing celiac disease, which is through an endoscopy that goes further than the stomach into the small intestine, and then a biopsy is taken of the wall of the small intestine, and there are characteristic changes of the absorptive cells, which are called villi in the small intestine. They're usually blunted. They don't work as well. So the GI doctors diagnose the condition, but they don't look for any other deficiencies that may have occurred in this individual from the celiac disease over many, many years. It's not just enough to eliminate the gluten, is what I'm saying. Okay. Nutritional supplements are not a substitute for a healthy diet. A balanced diet that includes a variety of fruits and vegetables, whole grains, lean protein sources, they will provide all the necessary vitamins and nutrients that most people need basically. But as I said, if you exercise or have a health condition or some other genetic need, or maybe there are medications interfering with your nutritional absorption, like antacids, you're going to need extra nutritional supplements. However, if you take too many vitamin supplements, that could be harmful, as I mentioned with the B6 example, leading to serious health problems, I should say. And also, I want to mention now is a lot of clients see me and their doctors ran B12 levels on them in the blood, and the level was high, and they get all panicked and tell the person to stop taking their B12 supplements. That's unnecessary. B12 has very low toxicity potential, and usually people have elevated B12 levels, not because they're taking too much, but I believe they're high simply because the ranges of acceptable B12 levels are too low. In other words, I believe people need higher B12 levels than the standard ranges. So based upon standard ranges, B12 might look elevated. So a B12 test, to give you one of the BloodDetective tests, is a serum B12 level. But the serum B12 level doesn't tell you the type of B12. It doesn't tell you if your body activated the B12 and can use it. That's why I almost always, but not always, but most of the time recommend methylated or activated B12 to people, so that when I see a rise in their serum or plasma B12 levels, I can assume that those are methylated forms. Another great test to do along with a serum B12 level, and it really needs to be done, is a microscopic test of the size of red blood cells. So a large red blood cell, if it's related to B12, if there's a B12 deficiency, the red blood cells get larger. So cells, by the way, macrocytosis is the term for large red blood cells. Macro meaning large, cyte meaning cell, large cell. Large red blood cells can happen when someone's deficient in B12, deficient in B6, deficient in folic acid, vitamin C, E, and B1, and from other causes. So that one finding of large cell size under a microscope can have a large range of nutritional implications. So let me give you a few examples of some toxicities of vitamins. For example, taking too much vitamin A can cause headaches, dizziness, and blurred vision. If you take too much vitamin E, you can increase your risk of bleeding. If you're taking too much vitamin C, that can cause stomach cramps, nausea, diarrhea, while too much vitamin B6, as I mentioned, can cause numbness in the hands and feet, which is a form of neuropathy. So in addition, some vitamin supplements can interact with medications or have adverse effects when taken in combination with other nutritional supplements or medications. So for example, taking vitamin E with blood-thinning medications can seriously increase the risk of bleeding, and that could promote a hemorrhagic stroke in a person. Another example would be taking vitamin C with iron supplements. That actually helps the absorption of what's called non-heme iron. Non-heme iron is the type of iron you get from plants like spinach. So vegetarians like to point out that spinach contains lots of iron, but it contains the form of iron that's not very absorbable. But if you take vitamin C along with the non-heme sources of iron, they're usually absorbed much better. So because of these subtle nuances and how to combine supplements and medications, for example, and distinguishing fat and water-soluble vitamin levels, all of this stuff it really behooves you to speak with a qualified healthcare professional before you start taking any nutritional supplement plan, because a trained professional can help figure out what vitamins, minerals, phytonutrients you might be deficient in or insufficient in, meaning you might have enough of them based on your lab work, but you might require more than enough, more than the average to get healthy again. Again, that's a type of logic that seems to be completely lost on untrained medical providers. Through my research previously, I discovered that the average physician has around 27 hours of nutritional education. So that's inadequate to make any advice. So when a client says to me, Dr. Wald, my doctor, this just happened and it's a routine in my practice, a person with breast cancer said that her doctor didn't want her to take any of the nutrients with the chemotherapy. And she was surprised to hear me say that I agreed with the oncologist, because if the oncologist doesn't understand how the nutrients are combined with her therapy, then I wouldn't do it either. But I had a conversation with a staff member at the office and explained the nutrition and was able to make a good case for it, and they all agreed that she should, in fact, take the supplements. That's amazing. This was causing my client so much tension and upset because, again, if having a diagnosis of breast cancer wasn't enough, to have her oncologist not want her to take nutritional supplements, that really put her over the edge. But we had good communication. It all worked out. So now I want to talk about nutritional supplements versus foods and understanding the role of each, which will vary from person to person. So nutritional supplements and whole foods play essential roles in maintaining a healthy lifestyle, a healthy diet, and meeting the body's nutritional needs. And your nutritional needs may change over time. For example, during the winter, I do a lot of running indoors, more running than I actually do during the summer. So my nutritional needs to deal with the stressors of running need to be accounted for. If I stopped running, then clearly my nutritional needs are going to change. If I get ill or I get some disease, my nutritional needs will change even further. So it's important to acknowledge that and understand that while supplements can complement a balanced diet, they're not to replace a clean food plan. And I'll discuss what I mean by that in a few minutes. But back to the role of nutritional supplements. So nutritional supplements are products designed to provide nutrients that might be missing or insufficient in a person's diet. And these nutritional supplements come in various forms, whether they're vitamins, minerals, amino acids, fatty acids, phytonutrients, and other nutraceuticals. And they may be in liquid form, powder form, tablet form, you name it, they come in that form. And I should probably mention, because this comes up a lot with my clients, they'll ask me, Dr. Wald, well, isn't a liquid supplement more absorbable than a tablet, let's say, or a capsule or a powder? And my answer is usually that it depends on the product, but generally speaking, no. If I take a poor quality tablet supplement, vitamin supplement, and liquefy it, it doesn't make it any more useful. Usually, nutritional companies are educated enough to provide nutritional supplement products in different forms, powders, tablets, capsules, based upon research that suggests that they might be best absorbed in those forms. But sometimes, again, I don't know you personally. I don't know your needs, but depending on that knowledge and my knowledge of the nutritional supplements, I might choose a different form of a supplement for you. For example, if I want a person to get in therapeutic amounts of fatty acids, let's say for cancer care, I wouldn't be giving them capsules unless they insisted on it, because they would need somewhere between 10 and 12,000 milligrams, or 10 to 12 grams. Now, it would be easier, and that would be a lot of capsules, but they could get the same dose by taking 2 or 3 tablespoons, which you can take very quickly. Imagine taking 15 or 20 capsules of fish oil, not to mention other nutritional compounds you might need. Okay, what are the role of nutritional supplements then? Nutritional supplements are products that are designed to provide nutrients that are missing, as I mentioned. And supplements can be particularly important for certain groups of people. For example, pregnant women need extra folic acid or iron. Older adults might be deficient in vitamin D and calcium for bone health. And sometimes individuals with restricted diets, whether they're vegetarians or macrobiotic, or those with food allergies, gluten intolerance, may use supplements in a way to offset the loss of nutrients that they're not getting in their restricted diet. So sometimes a restricted diet is necessary, but that doesn't mean that the diet has all of the nutrition that you need. The nutrition that you need should be based on what your health goals are, what your specific nutritional deficiencies or insufficiencies are, what other lifestyle factors might play into your needs, whether you are not sleeping well or under a high amount of stress, what specific health issues do you have, what medications are you on, how do you present physically, as I mentioned earlier, dry skin. Another example of how looking at someone can tell you something about their nutrition is if someone has bumps on the back of their arms in the tricep area, that's usually a fatty acid, sometimes a thyroid, and sometimes a vitamin A deficiency. If someone has dark circles under their eyes, that might be a sign of adrenal weakness, and the adrenals make various hormones like DHEA, so the person might need that. The adrenal glands store most of the body's vitamin C, so it may be a sign of needing vitamin C. So just looking at someone can give you a lot of clues. A person who's iron deficient tends to be pale, particularly if the iron anemia or iron deficiency is chronic. Okay. Now, relying solely on nutritional supplements without consuming a variety of whole foods can lead to missing out on the synergistic effects of nutrients found in natural food sources. Whole foods provide a complex matrix of nutrients that work together synergistically to support optimal health and well-being. So what you should understand at this point is that while nutritional supplements can be valuable for addressing specific nutritional needs or deficiencies or insufficiencies, they are never a replacement for whole foods. A well-balanced diet based on a variety of whole foods remains the cornerstone of good nutrition. So supplementation should be used judiciously and complement a healthy eating pattern rather than serving as a substitute for a diverse and nutrient-rich diet. Okay, let's get into some nutritional supplements. Let me just quickly give a disclaimer that this information is for your education, folks. It's not meant for you to go out and try all this stuff. So any use or misuse of the information in this presentation or on my website is at the sole risk of the user, which is you. Okay, to contact me, you can call me at 914-552-1442. You can email me at info@blooddetective.com, and the website is drmichaelwald.com. So nutritional supplements are products designed to provide nutrient levels that are very difficult to get by eating foods alone. And these can include vitamins, minerals, amino acids, fatty acids, and other nutritional compounds that are beneficial for health. So supplementation can help fortify the diet by providing specific amounts of various nutrients, and that's going to address deficiencies or insufficiencies and support overall well-being. So now what I want to do is give you specific examples of nutritional supplements that would be very hard for foods to fix, and I'm also going to make mention of some of the laboratory tests for each of these supplements. And after this presentation, you will know more about nutritional testing than most of your doctors. Now, that's fine. But if you can't educate your doctor, that's a problem. You might provide the notes for this presentation, for example, which has references in it, which you can find on my website. Okay, let's get to the first nutrient, iron. I chose iron as the first one because iron is the most common nutritional deficiency on the planet Earth. The most common anemia is iron anemia. And iron, you need to know, is essential for the production of hemoglobin, which carries oxygen in the blood. And iron supplements can be particularly beneficial for individuals with iron deficiency anemia and at those at risk of developing it, such as pregnant women or women with menstrual periods, because they're losing a lot of iron. And if their intake of iron is exceeded by the amount of iron they're taking in other words, if they're losing more iron menstrually than they're taking from the diet, they can end up with anemias. Now, anemia also occur in men, even though men don't have menstrual periods. But when iron deficiency occurs in a man, it needs to be taken especially seriously because a man does not menstruate, as I mentioned. An iron deficiency could be from loss of iron, let's say in the colon, from colon cancer, or it could be from hemorrhoids, usually either internal or external hemorrhoids. A person should not take iron unless they are deficient in iron, because that can cause quite a lot of damage to the body. And the best test for iron is actually several tests. It's the hemoglobin hematocrit test, and then the serum iron test, and then the serum ferritin test. The ferritin tells you long-term storage of iron, and the hemoglobin hematocrit lets you know that the body has enough iron or doesn't have enough iron to make adequate hemoglobin. There's more to say about all of these tests, so if you listen to the testing podcast that you can search at the search bar on the homepage of my website, you'll find a lot more detail about these tests. And then there's fish oil supplements, which contain omega-3 fatty acids. They're called EPA and DHA, which have long names: eicosanopentanoic acid and docosahexaenoic acid. That's EPA, DHA. These are fatty acids that are known to be beneficial for many things, certainly cardiovascular health, anti-cancer, anti-inflammation, blood thinners, brain health, and a lot more. There are tests for fatty acids, but I find them almost never needed because first, if I suspect that someone has fatty acid deficiencies of omega-3s, I'm going to give them omega-3 fats. If they have neurologic problems, then I might give them omega-3 fats which have higher levels of DHA. That's the DHA portion of the omega-3s because that helps the nervous system. If I felt they needed more cardiovascular support, I'm going to give them fish oil with a higher amount of EPA in it. So I do that first, and then if I think that things are not working and I believe I need to look at the fatty acid test, I'll do that. But since it's several $100s, I don't do it first if my first step is going to give omega-3 fatty acids anyway. So if you want therapeutic effects of fish oil, it's good to take fish oil because if you try to get your omega-3 fatty acid content from fish, you're almost certainly, if you eat fish more than even just twice a week, you're very likely to suffer from heavy metal toxicity and other toxins like arsenic, cadmium, iron, and lead that are found in fish. And if you're going to eat fish, fine, but you need to take real chelators, which are detoxifiers, real detoxifiers. When I say real, there's a lot of so-called detoxifiers and chelators in alternative medicine that do not work. So depending on your situation, there's different choices for the best chelators that remove and bind to and take out of the body metals that can be found in fish oil. And I do have a podcast on heavy metals that you might want to listen to. And then there's calcium. Calcium is crucial for bone health and muscle function. Calcium supplements are often recommended for individuals who do not consume enough dairy or who are at risk of either osteoporosis or osteopenia. Plus, people on antacids, which can cause malabsorption, can become deficient in calcium. If a person has a malabsorption disorder, if a person has an eating disorder, their calcium levels will go down. And calcium levels that go up chronically might indicate a genetic issue with your parathyroid gland, which is the gland located on either side of the thyroid, which helps control calcium levels in the blood. The way to check calcium levels is a blood serum calcium level. The best test is an ionized calcium level. Most doctors don't specifically ask for ionized calcium, but it's better than non-ionized calcium. And then there's calcium levels that are of the urine. Let's move to vitamin D. So vitamin D is a critically important nutrient for calcium absorption and bone health. The other thing about vitamin D is that it plays an essential role in immune function as well as mood regulation. And you probably are aware that most doctors these days, they're aware of vitamin D. That's because the information just got so overwhelming and it was so positive that doctors are aware of vitamin D's importance, but very few know how to properly interpret the testing. There's vitamin D serum levels on the blood. The ranges of vitamin D should be between 30 and 100. Some doctors say if you're 31, you're normal. But we know that the higher normal your vitamin D level on the blood, the lower your risk of dying of anything. Said another way, and also the higher your quality of life, the higher the vitamin D level is in the blood within the normal range. So a 70 blood level of vitamin D3 is far, far more healthful than a 33. Okay? How much vitamin D should you take? You should have a vitamin D test taken, a vitamin D3. And if you're deficient and of normal weight, you'll want to take 50,000 units of vitamin D once a week for 8 weeks and recheck your blood. And then you'll take a lesser amount most likely so that you can slowly or more accurately bring your vitamin D up to reach a 70. That's really where you want it to be. Then there's vitamin B12. There's serum and plasma levels of B12. And I mentioned earlier that the size of red blood cells under the microscope can tell us about B12 need. It takes expertise for doctors to figure this out, but it is true that a large red blood cell might indicate a need for extra B12, even if the plasma or serum level of B12 is normal, or even if the serum or plasma level of B12 is high. It could be high because it's not in the cells. And if it were in the cells, like the red blood cell, the cell would be normal size. So B12, you should know, is essential for nerve function. It's needed for the production of DNA and having the body make red blood cells. So it's not only iron that helps the body make red blood cells. In fact, when someone is anemic with iron, they usually are also anemic with B12. And plus, iron and B12 deficiencies are very common in vegetarians. Most vegetarians that I meet, and I meet a lot of them and have over my 31-year career, is they're always deficient in protein, they're always deficient in B12 and iron. They don't know how to properly balance their diets. This is where nutritional supplements can come in. And then there's probiotics. So probiotics contain beneficial bacteria that support gut and digestive function. They can help maintain a healthy balance of microflora and aid in various digestive issues. Probiotics should not be taken along with antibiotics unless you are very educated about whether or not the specific antibiotic you're taking will interfere with the specific bugs in your probiotics. As far as testing for probiotics, that's done through stool testing, where there can be estimates made of the amount of various bacteria in your gut. Okay, the next one is magnesium. So there is a serum or plasma magnesium test, which tells you the last 3 or 4 days of your magnesium intake. That's not really a lot. That's not very useful. It might be more useful in a hospital setting. But if you wanted to know a several month average of your magnesium levels, you'd want to check a white blood cell magnesium level. You should know that magnesium is involved in about 500 different biochemical reactions in the body, including energy production and muscle function, blood pressure control, relaxation. It helps neuroplasticity for the brain. It helps mood and behavior. Magnesium supplements can be beneficial for those with magnesium deficiency causing muscle cramps. Also, magnesium deficiency can cause vasospasm. Think of a blood vessel spasming closed. There might as well be a clot there at the area of closing, and then a person can have brain damage or a transient ischemic attack or a TIA or a mini stroke. That then the muscle, after all the damage is done, the blood vessels open up, and that comes too late, obviously. So you want to make sure you have proper magnesium levels. And then there's vitamin C. I like to check the urinary vitamin C because if a person has enough vitamin C in their bodies, they will have some spill out in their urine. You can also check plasma levels of vitamin C on the blood, and that does have some utility. Vitamin C is involved in over 3,000 different enzymatic reactions, so everyone needs to get vitamin C correct. And if it's not correct in terms of it being deficient, then depending on your particular circumstance, your healthcare provider might have you do a vitamin C flush test. If you don't know what that is, look up vitamin C flush test on my website. It'll tell you everything you need to know. So we know that vitamin C is an antioxidant. We know that vitamin C supports immune function, skin health, wound healing, and it's even beneficial during times of increased stress because vitamin C is a required cofactor for enzymes that allow the body to deal with the stress response, okay? And then there's zinc. So there are serum and plasma zinc tests. There are also white blood cell zinc tests. I think the best test for zinc is you give zinc to someone and you help them. Although it is important to measure a blood level of zinc because zinc is a mineral, and minerals are more susceptible to toxic problems than vitamins. So you want to make sure that you don't give someone too much zinc. Usually the amount of zinc you give, which is usually safe for most people, is no higher than 50 milligrams. If you stay at around 30, that's probably going to help the person and you won't make them toxic unless they have some processing issue in their bodies or in their liver, or their kidneys, I should say, where the body can't excrete excess amounts of zinc because of kidney dysfunction. So there are many reasons to consider the use of nutrients differently given the different health status of a person. And then there's folic acid, which I've mentioned a few times. Folic acid is crucial for cell division and the prevention of neural tube defects during pregnancy. 80% of birth defects are caused by folic acid deficiency, and it still amazes me that the folic acid given by most doctors that's prescribed is not even the activated methylated form, which is the one we need to prevent neural tube defects or congenital issues in newborns that develop during the embryonic unfolding during pregnancy. So the size of red blood cells also is a potential indicator of an increased need for folic acid. The red blood cells will be too big. So what are some other advantages of nutritional supplements versus foods? Well, there's a couple that I can come up with here, and I want to let you know about these and take this section of the podcast seriously because there are some people that for whatever reasons, philosophical or what have you, they do not take nutritional supplements. These are usually the more neurotic types that are into holistic health, that imagine they have lots of health problems, that believe that nature has all the answers. Well, nature has a lot of answers, but you might even argue that it's natural for human beings to have absorbed nutritional supplements. But beyond all the philosophy, there's many obvious needs for nutritional supplements. One, I mentioned a few times, has to do with if you want countable amounts of specific nutrients for specific conditions, and maybe you read some studies that say this amount of magnesium is needed, this amount of vitamin C is needed. If you go by food charts that estimate the amount of nutrients in these foods, they're all wrong. But if you give someone a supplement with a specific amount in milligrams or grams of a particular nutrient, you can count on that, assuming that the supplement is of good quality, that you're going to get that. And you need to concentrate some of these nutrients to push these pathways in the body to create health. So what are some advantages of nutritional supplements versus foods? One is convenience. Nutritional supplements are convenient. They come in various forms, pills, powders, liquids, making them easy to consume on the go, especially for individuals with busy lifestyles. And then there's this concept of nutrient concentration, which I've been talking about. Supplements can provide a concentrated dose of specific nutrients that may be lacking in one's diet, ensuring that the body receives essential vitamins and minerals in the exact amounts that you want. Now, that doesn't mean that the person's going to absorb those normally, but at least you know what you're giving them. And then there is nutrient absorption. I just led into this. So some individuals may have absorption problems due to digestive issues or various medical conditions, and they may not absorb what they're taking in terms of supplements. And I've mentioned this many times throughout my Ask the Blood Detective podcast. I've mentioned that we are not what we absorb. I just said that wrong. Okay, let me say it again. We are not what we eat. We are what we absorb and what we activate. I'll say it again. We are not what we eat. We're what we absorb and what we activate. So there's the eating of the food, then it needs to be absorbed, and then those nutrients absorbed need to go to, for example, the liver or the kidneys or wherever else in the body they need to go to become activated. So you need those three things happening. And then there's customization. Supplements can be tailored to meet individual nutritional needs, allowing for personalized supplementation based on factors such as age, gender, activity level, and specific health reasons, even genetic issues. And there's others. Another advantage is the targeted support. So certain supplements are designed to address specific health issues or support particular body functions. So if I want to increase glutathione in a person's lungs, this immune molecule, I want to do it in 20 minutes, then I'm going to use N-acetylcysteine to do that. If I want to remove mercury from the body, I'm going to also use N-acetylcysteine. The bottom line is that you might have to use supplements for targeted nutritional support that might not be easily achievable or achievable at all through diet alone. And then there's bioavailability. In some cases, the nutrients in supplements have much higher absorbability compared to those found in foods, meaning that they're more readily absorbed and utilized by the body. So if you eat foliage, like plant food, like a lettuce, let's say, you're going to get a form of folic acid in there it's not activated, but you can get the activated form in a supplement form. In the plant foods, you can get non-heme iron, and you could take, however, heme iron, the more absorbable iron, in a supplement, particularly if you didn't want to eat meat, which is exclusively heme iron, the best iron. I'm not suggesting you eat animal products or meat if you don't. I'm just simply stating a fact of science that the iron in plant foods is not nearly as bioavailable as that in animal products. And then there's the concentration of, let's say, phytonutrients, plant-based nutrients. So supplements can provide concentrated amounts of beneficial plant compounds, phytonutrients, that might be very challenging to obtain in sufficient quantities, from food alone. So when I have clients coming in that say that their kids don't eat any fruits or vegetables, I try to give them superfood powders that can be hidden, let's say, in a diluted glass of orange juice or apple juice. I don't like people drinking fruit juices, but if they're going to, and if it means hiding some nutrients that can give a better level of health compared to the concern I have with the fruit juice intake, then I'll recommend it. But I'll usually say to take the orange juice or apple juice and half it with water, and then to put half a teaspoon or a teaspoon of a superfood in there of phytonutrients can just enhance the nutritional quality of children's diets and adults' diets dramatically. And then there's the concept and advantage of supplements that they simply fill nutritional gaps. So for individuals with restricted diets or specific dietary preferences like veganism or vegetarian, supplements can help fill potential nutritional gaps that arise from limited food choices. So that should be pretty obvious. And then there's the concept of convenience for specific groups. So certain population groups, such as the elderly or individuals with medical conditions, might find it more convenient to obtain essential nutrients through supplements due to the challenges related to chewing, swallowing, cooking, or digesting their foods. So thank goodness for supplements. Otherwise, these people would die of starvation. Then there's supplementation during illness or recovery. So, during illness or recovery, certain medical procedures, nutritional supplements can play a supportive role in meeting increased nutrient demands and aiding the body's healing processes. And then there's enhanced performance advantage of supplements. Athletes and individuals engaged in intense physical activity may benefit from specific supplements designed to enhance performance, support muscle recovery, and optimize energy metabolism. Just a couple more I want to give you in terms of advantages to supplements, because it should not be taken lightly when you decide to take supplements. Okay, there's long-term storage stability. Unlike perishable foods that have limited shelf lives, many nutritional supplements have very long-term stability when stored properly, ensuring that the nutrients remain available for extended periods of time. And then there's controlled intake of specific nutrients. Supplements allow for precise control over intake of specific nutrients, which can be particularly beneficial when you're targeting therapeutic doses for certain health problems. And one last one, in terms of benefits of supplements, is compliance with at least meeting dietary guidelines as a baseline. So in some cases where dietary restrictions or medical conditions make it challenging to meet recommended nutrient intakes through foods alone, supplements can help individuals comply with established dietary guidelines and prevent deficiencies. Okay, I mentioned earlier some laboratory tests for some nutritional deficiencies. I wanted to go over a few others for you that have to do with the more common supplements. I mentioned vitamin C, and I like the urine levels, which I mentioned to you earlier. And then there's urinary calcium. Most doctors will just do the blood calcium. Smarter doctors will do the blood ionized calcium. And then the real smart ones will do the blood ionized calcium and the urinary calcium, because urinary calcium levels can be indicative of both calcium deficiencies or excesses. So it's important to know what the body's excreting. And then there's a test that is actually a finding that is observed by a practitioner who puts your blood sample under a microscope. If your red blood cells are stacked on top of one another, they won't all be that way, otherwise you'd probably be dead. But if you have stacks of red blood cells where you have 4, 5, 6, or 10 red blood cells stacked on top of one another like pancakes, everywhere those pancakes touch, they lose surface area for oxygen and nutrient exchange. So those 10 cells might be the equivalent to 2 or 3 cells. And those 10 cells are heavy and they're in circulation and they have to be moved around in circulation. So that could be a cardiovascular risk. But these stuck cells that look like stacks of pancakes is called rouleau formation. Rouleau is a fancy term for red blood cell stacking. It's a French term. So don't let it fool you. It does mean that there's inflammation in the body, but it doesn't tell you where that inflammation is arising from or what it means. Although there's certain nutritional focuses upon rouleau formation that can reduce rouleau formation, but that's specific for the person. The benefit of the rouleau blood test, the microscopic test, is that it can pick up inflammation long before a regular blood test does. The same thing for looking for large red blood cells. Large red blood cells are somewhat indicated on a regular blood test. There's a test called MCV, mean corpuscular volume, which generally means red blood cells are large. But if you have a bunch of normal sized red blood cells, folks, and they're sticking together in your circulation, and in the lab, those cells go through the machine, and if 5 of those cells are stuck together, the machine might count that as one type of cell, which might be the exact size of a white blood cell and might mistake a bunch of clumped red blood cells for white blood cells. My point is, you need to look under the microscope as well. So large red blood cells are called macrocytes, so you want to look for macrocytes. If someone has anemia, iron anemia, they'll generally speaking have microcytes or small red blood cells. And then if you give the iron, for example, for the iron anemia and you fix it, you need to make sure the size of the red blood cell is fixed. It's not enough that the hemoglobin and hematocrit, serum iron, and ferritin, the other iron tests, are fixed alone. There are other iron tests, as I mentioned just now the serum test and the ferritin and the hemoglobin. And there's another one called transferrin saturation and another one called TIBC. I'm not going to go into those now, but if you want to read my notes for today's podcast, you can do that by searching Vitamin Vitality on the homepage, and it will come up. Then there is the complete blood count, CBC. Almost every doctor does this. It reveals lots of different things. It has red blood cells. It has all the different white blood cells. And it's just a basic set of tests that everyone should get. I've mentioned vitamin B12 tests before and folic acid tests. Those are best done by looking at the size of red blood cells under a microscope and also looking at the blood levels. And then let me just give you a couple I didn't mention earlier, like iodine. So iodine is essential for thyroid hormone function, and testing for iodine levels can be very helpful in finding deficiencies that can lead to thyroid disorder like goiter or hypothyroidism, which is low thyroid. T3 and T4 are thyroid hormones. They can be measured in the blood. T4, the 4 means 4 iodines attached to the T, and the T is an amino acid called tyrosine. The body has to take T4, pull off one of those iodines, so now there's just 3, and now it makes T3, which is the active thyroid hormone. Now, I could go on and on regarding other lab tests for nutrition that might be good for you to think about, but how a qualified practitioner should approach you to determine if you need vitamins, what percentage of your healthcare and the health building approach should be food-based on a number of factors. One is practitioners will provide you with a detailed historical group of forms, their paperwork, which you need to complete, and they will go over with you. By doing that, the practitioner can identify and clarify what your various health problems are and what tests that practitioner thinks are the most important for you, and even the best forms of tests that are most important for your particular case, which, by the way, could change over time depending on the clinical experience and knowledge of that provider. And of course, if you add some of that, and if you talk to your provider, well, what about this vitamin D test? And what about macrocyte tests? What about the urinary calcium test? You might be surprised when some practitioners say to you, well, that's interesting. Yes, I can do that. And the only thing I caution you with is that if you ask your healthcare providers that don't normally test nutritional tests, they may be convinced by you to do that, but when your tests come back abnormal, they may not know what to do about it. And it's not as simple as your B6 is low, take B6. We need to know why that is. Maybe it's dietary. Maybe your health problems have increased your need for B6 or any nutrient I could be talking about. Or maybe you're taking in just too much. Or maybe you're on a medication that's affecting the blood levels of the vitamin. Or maybe you have renal disease, which is causing artificially normal-looking levels or even high levels. So a qualified nutritional provider who has license to order and interpret laboratory tests is best, in my opinion, for any health problems that are chronic, which means they've been around for several weeks and they're really not getting better. All right, that's going to do it for today's episode of Vitamin Vitality. My name is Dr. Michael Wald, the Blood Detective. You've been listening to Ask the Blood Detective. Thank you again, and I'll see you at our next show. And don't forget to let me know what your thoughts are on this show or any podcast by calling me at 914-552-1442 or emailing me at info@blooddetective.com. Check out the website at drmichaelwald.com. Thanks, everyone. Have a great day.